Hi, friends. This is Nurse Diva Desi coming to you. I'd first like to start off by giving ourselves a positive affirmation. My mind is like an oyster, a beautiful pearl. We can do anything in this world. And we need this, my friends. We need this positive affirmation because we are nursing students and we are tackling the immune system. Another way we can say this is immunology, the study of the immune system. So let's start by saying a few things. What is the immune system? I'm going to pause right here and let you ponder that. So, the immune system is an intricate group of cells, tissues, organs, and substances that fight off infection. And this is so germane to what we're going through right now with the novel coronavirus, or better known as COVID-19. The immune system is a fascinating concept for nursing. The immune system is something that is very complex, and we need this, and we have to have a good understanding of the immune system in order to take care of our patients. The immune system is like a computer. It can store and record every germ. Another word for germ would be microbe, okay? So the innate immune system, that's something that's within us. We are born with this. So this type of immunity or protection that we have to fight off, remember the word microbe because that's a germ, is something that we were born with. Again, innate is something that you have and I have, and it was given to us at birth. Another way that we can say innate immunity is non specific immunity. Now, what does non specific immunity mean? This is basically your body fighting off, remember the word microbe, fights off infection. So our body is fighting off infection in a very general and non-specific way. So that means it's not killing any particular germ, it's just doing something very general. We have something called general barriers to protection. But I'm going to pause on that. Before I go there, I want to again ponder a little bit more on the innate defense, non-specific immunity. So I'm going to use this example. My son, who I'm very proud of, is 14 years old and he's 6'2". Now, he is very tall for a 14-year-old, and he has not reached yet his growth, his height that he would be for an adult. He still has time to grow. So, when you talk about innate, he has this height, and you compare him to maybe someone that's an average size of say 5'5", 5'6". And let's use the sport of basketball. Well, guess what? You can't coach height. Height is something that's a God-given trait. It's something that's given to you. So his height, he's going to have an advantage no matter what because of his height. Even if he can't play, if he could just take his arm and hit the basket with the basketball, I believe it would go in because he is super tall. So he has this ability to do this because of his innate ability is his height. It was something that he has that nobody or someone else has, but the person we're talking about comparing him to is someone that's 5'5" or 5'6". So again, the coach can coach you and help you to play better, but he can't coach your height. You either have it or you don't. So that's my point about the innate defense system. It's something that's we have already. Okay, what exactly is immunity? Immunity is the protection against foreign pathogens or substances, which we can call antigens. Again, immunity is protection. We're protected against foreign pathogens or substances other known as antigens. So what does that mean? Pathogens are bacteria, foreign bodies. Again, antigens are foreign bodies. Pathogens, bacteria, basically protecting us from things that are bad. So when you hear the word antigens, the word anti is against. It's something that's bad. So even if you can't remember antigens, just think anti bad, foreign pathogens. Foreign meaning your body has no clue or idea of what this bacteria is. Let's go on. How can we activate immunity without causing disease? And I'm going to pause and let you think about that for a minute. How can we activate? How can we start this, get it started? How do we get our immune system started without causing disease? Well, the big thing that's going on right now with COVID-19 is vaccination. We can activate the immunity without causing disease via vaccination. So vaccines give us immunity. Now, this type of immunity, because there are various types of immunity, this type of immunity would be called active immunity. But again, this is something for another video. So, we activate our immunity without causing disease by vaccination. Next question. What are lymphocytes? Now you hear two words in this one word. So a way for us to understand what we are learning is by using context clues or breaking down the word so that we can get a better understanding of exactly what is this question asking of us. When you hear the word lymphocytes, there are two words, lymph and then cytes, cytes. So cytes are cells and lymph is white. So these are white blood cells. We have three types of white blood cells. These three types put together are called agranulocytes. The three white blood cells we have are called NK cells, which are natural killer cells, T cells, and B cells. And these all are our mechanisms, again, to help us fight off. What are we fighting off again? Foreign pathogens, substances, the A word, the antigens, foreign bodies, things that have no business being with us. So I'm going to stop here, guys, my friends, and let you soak in these concepts. These are the beginning concepts of the immune system. Thank you for tuning in, and I hope to see you next time. Bye bye.